Get ready for the next battle.
Hello, welcome to the channel, all two of you, or less. Yeah, the video today is gonna be about the Nipah virus because I've been seeing people kind of worried about it. Yeah, this is different from what I've been posting on this channel before. That said, I guess there will be changes coming to the channel that I'll just talk about at the end. Let's just go straight to the video right away. So, these are gonna be the references for this video. Check them out if you like. Probably don't care about reading those, but hey, here you go. I'll be dividing the video into what you need to know for everyone interested, not just doctors and med students. Because a bunch of people have been concerned about the Nipah virus outbreak in the news, right? I'll be putting a timestamp also for the parts that the doctors and med students would care about for their studies, for board review, and all that. I actually recommend that you guys watch that because, from my experience, a good number of professors and the board of medicine would ask about the diseases that are coming up in the news, especially in the case of public health and preventive medicine. So anyway, what do you need to know for everyone interested? The Nipah virus is transmitted through direct contact with bats, pigs, or contaminated fluids and food. Take note though that the fruits may be contaminated with fluids from fruit bats. Of course, they eat fruits. They're actually a common pollinator for certain areas, such as here in the Philippines, in the tropics. So, it's not just animal contact that could cause it. Human to human transmission could also occur when there's close contact with body fluids. For those who are infected already, of course. So the people who are vulnerable here are the farmers, those who harvest fruits, and of course, healthcare workers, as usual. Take note that it's not transmitted in an airborne medium. I get that a bunch of us are still reeling from the whole incident of COVID. And there were frequent issues about whether or not it's airborne, aerosolized, just from fluids, you know. But the fact is, the Nipah virus has existed even before, and it's already confirmed to not be airborne, and again, transmits through physical contact with fluids. So you don't need to freak out over an unknown disease this time. Now, it has a fatality rate of 40 to 75%. I get that that's a kind of large range, but it depends on a lot of factors, right? The context of the outbreak, how accessible is healthcare to the patient, and of course, the monitoring or surveillance of anyone who has already been infected. Those who are at risk, as I mentioned earlier, are those who are in contact with pigs, bats, contaminated foods. In the case of the Philippines, we're an agricultural country in the tropics, and fruit bats are among our major pollinators. So, if it gets to the Philippines, you would say that we're more vulnerable in a sense. Of course, that is not considering precautions about isolation, identification of the infection, and all that. Of course, healthcare workers will be alert to the possible infection of Nipah virus, so can rely on them at least to keep it at bay. While they are also at risk, unfortunately. as we always are. Now, what symptoms do you need to look out for? Um, there's a wide range again of possible symptoms. Some could be asymptomatic, and they could also be severe, including respiratory disease, encephalitis. Of note, though, um, after getting infected, the earlier signs you'll be noticing are fever, headache, muscle pain, vomiting, and sore throat. You'll notice that these are very common symptoms, right? Some people would feel these things from a flu, right? It's said to mimic or to copy a similar presentation as certain tropical diseases. So if you're gonna go with the early stages, it's actually not very helpful for identifying whether or not you have the Nipah virus. Regardless, of course, monitor yourself. If possible, isolate. Even if it's just a flu, you might as well prevent other people from getting it, right? And of course, if it increases in severity, go to a hospital, have it checked. People there can determine whether it's Nipah virus or not. Okay? So the other symptoms that could show up after the early stages is dry cough, difficulty in breathing, dizziness, drowsiness, confusion, seizures, and there could also be encephalitis and coma within 24 to 48 hours. It's pretty fast, as you could tell. At that point, it's pretty obvious already that what you got was a Nipah virus. A regular flu won't cause you to go into coma after 24 to 48 hours. So how do you treat it? Unfortunately, there's no specific medicine that's given for it, or medication rather, and there's no vaccine for it either. Should someone be infected, the focus is on support, addressing the symptoms, right? Managing the electrolytes and fluids in the patient's body, making sure they're able to have ventilation, given oxygen if necessary, and of course to control the seizures should they arise. In severe cases, of course, they're sent into critical care. Please have them admitted to any hospital equipped to handle it. Okay, so how do you prevent yourself and other people from getting the Nipah virus? As of the time of making this video, there have been no reports of someone in the Philippines contracting it. So, at the very least, I would like to think that the screening procedures for the incoming flights would be thorough enough to prevent it from spreading throughout the Philippines as well. Anyway, yeah, the same with COVID back then. Wash your hands regularly with soap and water. Of course, try to not be exposed to the means of transmission that I mentioned a while ago. Fruit bats, the pigs, the contaminated food, and of course, people who have been confirmed to be infected, right? I've also read that there was an incident during a previous outbreak that happened in the Philippines. Some of the patients have reported contact with horses. So, if at all possible, you might want to avoid like horse body fluids as well. Perhaps their saliva. Of course, also avoid contact with blood or body fluids of a human, another person with Nipah. But at the very least, like I said, there's no one currently reported to have it in the Philippines. I can't say for other countries though, for any foreign people watching this, all zero of you. Of course, If someone is infected already, it's best to be able to identify it right away and isolate. Which is why if a regular flu becomes more than a regular flu, uh, try to have it checked at a hospital. Okay, and of course, pay attention to the news. Regular updates will be mentioned if there are any infections that occur within the country. Knowledge will always be the best way to avoid something dangerous. And that's why I'm making this video, actually. So, that's it for the must-knows for everyone. Feel free to click off the video now if you're not a doctor or medical student. I mean, you're free to stay, of course. If you're aspiring to be one, you just like medical videos, or you're a bit of a nerd like me. So, let's get to it then. So, the Nipah virus is an enveloped single-stranded negative-sense RNA virus in the Paramyxoidae family, genus Nipah virus. As mentioned in the previous section, its reservoir is the fruit bat, right? Also known as flying foxes, with the genus Theropus. It was first identified in Malaysia and Singapore back in 1998 to 1999. There was a pig-human transmission. This is why, despite the bats being considered a reservoir, there is evidence of pig transmission, so it's also advised to avoid those if you want to be safe from the Nipah virus. Since 2001, there were also outbreaks in Bangladesh and India. There's one recently, actually, and they are often related to bat or contaminated food exposure, right? Every once in a while it happens. There are cases found in the Philippines. So transmission occurs via zoonotic spillover. That's the medical term we use for what I said earlier. It involves direct contact with infected bats, pigs, or contaminated fluids, or the food that they're contaminated with. An example that's mentioned in the sources I saw is the raw date palm sap. Of course, human-to-human transmission can occur. That's why we're making this mainly. It's through body fluids, right? And of course, the caregivers and healthcare workers are the ones who are at the risk of being in contact with those. The case fatality is already what I mentioned earlier. And the risk factors are the being in an agricultural job, right? Harvesting fruits, anything that could get you in contact with bats. So I guess biologists also count certain kinds. Contact with pigs, again, agriculture. And of course, contact with infected people. As I keep saying, healthcare workers, frontliners. The pathogenesis and clinical features. Incubations typically between 4 to 14 days. I've seen one of the sources says 4 to 21. Actually, I'm honestly not sure which to follow there. But hey, there are also reports that it reaches 45 days. Rarely so, but it's still worth noting, right? The clinical spectrum may range from asymptomatic to severe respiratory disease and fatal encephalitis. The early stages would have fever, headache, myalgia, vomiting, sore throat. And as mentioned earlier, the early stage looks a lot like other tropical infections. These are the following symptoms after the early stage, which are divided into respiratory and neurological, right? So dry cough, dyspnea, and you could actually go to respiratory distress and atypical pneumonia. In the case of neurological symptoms, there will be encephalitis that develops within a week, and the most common symptoms being altered mental status, areflexia, hypotonia, segmental myoclonus, gaze palsy, and limb weakness. There is rapid onset of dizziness, drowsiness, confusion, seizures, and as mentioned earlier, encephalitis and coma can occur within 24 to 48 hours. Now, being infected with the Nipah virus is not a death sentence. There are survivors, of course. The thing is, though, even the survivors can have neurologic sequelae, right? It could be cognitive changes, seizures that occur. There's a possibility of relapse or delayed post-infectious encephalitis, which of course you'd have to deal with, as mentioned earlier, in a supportive fashion, right? There's no confirmed medication to get rid of it. So for the diagnosis, consider patients with the compatible symptoms plus epidemiologic risk. This is why your history is important. You should know if the patient has been exposed to bats, pigs, or someone who has confirmed infection. For lab testing, RT-PCR. Remember COVID? Yes. Serology is also done for diagnosis and surveillance, although that's retrospective. And virus isolation, although the facilities which would have that are fairly limited. You can't really do it regularly. The challenges to diagnosis are the early signs are non-specific. They look like someone who just has a flu in a tropical country, right? Diagnosis will also be harder because RT-PCR and virus isolation is not exactly easy to act. I mean, it's accessible, but it's pricey. It's not like everyone can have access to it, right? So how to manage it? Unfortunately, there's no antiviral therapy that's specifically used for the Nipah virus. There's no vaccine for it either. The management would focus on supportive measures such as managing the fluid electrolyte balance, ventilation, control of seizures, management of the increased intracranial pressure, and of course, when they're severe, when they have acute respiratory distress or encephalitis, they're brought into critical care. There are therapies that have been tested historically, such as ribavirin, although those are evaluated in animal models and there's not much human data that could be used. So technically, the studies aren't enough. Vaccine candidates are also in development, but none are approved as of now. Hence why it's not, distributed worldwide. So how do you control infection in a public health setting? Of course, nosocomial precautions for the hospitalists. There needs to be standard droplet and contact isolation for suspected and confirmed cases. Aerosol generating procedures would also require precautions. Prevention could also be done by avoiding fruit bats, right? There are bats in a certain area, let's say you don't know whether they're fruit bats or those that eat insects or blood, like don't bother identifying them. Just stay away from bats, right? Also avoid contaminated food. This would be harder, of course. Make sure to clean your food, your fruits, and protect those that are like already harvested, right? Of course, it's best to identify someone already infected, right? To have them isolated to prevent further transmission. And in endemic regions rather, such as in Bangladesh and India, it's of course important to have surveillance, monitor people who get infected, isolate them as soon as possible, have policies in line to prevent people from getting infected, right? Of course, public health, inform the people, videos such as this, like, comment, subscribe, should also be shown to as much people as possible, actually, to help them be informed with what symptoms to watch out for, what are the situations that could get them infected, right? It's a public health thing, right? It's up to the physicians, of course, to inform their patients. Healthcare influencers, people, please inform your viewers, your followers. Have a sense of social responsibility, right? Okay, so what should be your key takeaways for this? Make sure to have a high index of suspicion for patients who have relevant symptoms and correlate it with their histories, whether or not they had physical contact or exposure with any of the aforementioned vectors in their histories. Okay? Early infection control measures are also essential to prevent nosocomial spread. So, actually, even not just nosocomial, whether you're in the hospital or an outdoor setting in the community, there should still be efforts to minimize the possibility of transmission or initial infection to begin with. Again, pay attention to the news. Right now, there's none in the Philippines yet. There's just been those few cases in India. I'm not updated with their news though. I hope it didn't spread in their case. But yeah, make sure to be informed, to inform others, and avoid possible vectors. Supportive care is the cornerstone of treatment. There's no specific medication or vaccine. You address the symptoms that arise. There are respiratory symptoms, provide ventilation, right? Neurologic, give something to control the seizures. Okay? Seizure medications. And of course, if someone's admitted, you would probably have access to their laboratory results. Not everyone will have access to confirmatory laboratory tests, unfortunately, which is why, again, history, physical exam are of utmost importance. But of course, while you're doing that, try to protect yourself too. We don't need, like, even healthcare workers getting infected, right? No one wants to get sick. Public health strategies, surveillance are also critical for outbreak prevention and response. So, the public health peeps, the government doctors, it's not just them actually. It's a community effort, right? Let's admit that. Even people who are not in the healthcare professions. It's everyone's responsibility to keep each other safe from infections that could spread. All right. So, yeah, that's the end of my whole spiel about the Nipah virus. So, yeah, I said earlier that there will be changes happening to the channel. Um, my initial idea of using LSS, using AI generated songs to have people memorize medical information doesn't seem to be working out, honestly. I barely get any views, if I'm being honest. It could be because people don't really like AI. I get that personally. I just thought that, hey, maybe if you use AI in a productive way, it would be more welcome, right? But, it is what it is. I did notice that my intro video has relatively more views, so I'm assuming that listening to me yap about stuff would actually be better for the channel. Of course, this is a small channel. I am not monetized right now. I'm doing this as, to satisfy my need to provide some sort of public service, despite not really being viewed. I mean, I'm not sure how much public service I'm giving if no one's watching, right? Yeah. But yeah, still, my target audience for this channel includes medical students, right? I made this video both for them and for the non-medical, non-healthcare people too, because, like I said, some might be freaking out about the Nipah virus. They should stay informed. And also for the medical students, let's say it doesn't show up in your exams, I'm pretty sure that some of you will have friends and family who will ask you about it. So hey, at least you could either show them the first part of this video, or you can just watch it and tell them yourself, right? That said, I still have plans for future videos, maybe more of me yapping, study guides or study tips, rather, stuff that gets into the public attention that's related to healthcare. Yeah, I'll probably focus on those. My content will be comprised of that and some YouTube shorts, I guess. I'll maybe make abridged versions. Some would be the same video, but with me speaking in Tagalog instead to, inform people who in the Philippines who prefer Tagalog content, right? Most Filipinos can speak English and understand, but hey, we enjoy what we enjoy, right? If you're gonna be more receptive to healthcare stuff by me speaking in a different language, sure, right? Yeah, share this with your friends, I guess, who may care. Like, comment, subscribe, all that YouTuber jazz. You know what to do, guys. If you've watched up to the end of the video, that's very much appreciated. And I guess I'll be seeing you next time.